Mr. Vice President, thanks for spending some time with us today. We have a brief amount of time, so I want to jump right in. This week, the Lieutenant Governor of Texas suggested that we need to get the economy moving again, even if that means putting our seniors' lives at risk. And he suggested, Mr. Vice President, that the elderly, our own grandparents, would be willing to die just so stores can reopen. Is that where we're at with this crisis right now? Are we really going to be telling the elderly that they should sacrifice their life for the sake of the economy?
Well, from very early on, President Trump has made it clear that we would bring not just a whole of government approach, but a whole of America approach, and that we would focus on those areas of the country most impacted by the coronavirus and on Americans for whom the coronavirus represents the most serious threat. You know, for most Americans, even those that contract the coronavirus, the threat of serious illness remains low. Even if you catch the virus, you'll have either mild symptoms or flu-like symptoms and recover. But for seniors, especially those with serious underlying health conditions, the threat of very serious consequences remains real. That's why several weeks ago, the President's coronavirus task force recommended and the President approved an increase in guidelines for every nursing home in America to prevent the spread of infectious disease. We've limited visitors to nursing homes around America. And as we work to reopen America, as the President said, in the weeks, not months ahead, I can assure all of your viewers that we'll continue to focus on those most vulnerable, and we'll continue to equip the American people with the kind of practices that will protect the health and safety of Americans for whom the coronavirus represents a very real threat.
And Mr. Vice President, I want to take you up on that point about reopening the country, because some states right now are on lockdown. They're in shelter in place to help kind of flatten the curve of this virus. Well, the number of cases is now skyrocketing in parts of the country. The number of deaths is growing by the day. But the president, as you just mentioned, said that America will be back open for business by Easter. Well, that's about 2 weeks away. Question is, why Easter? Is that a decision that is based in science? Because many health professionals, including those on the coronavirus task force, say that social distancing is the only way to slow the spread of this virus, and that opening up the country too early would be catastrophic.
Well, rest assured, every decision President Trump has made and every recommendation that's come from the coronavirus task force at the White House has been driven by the most brilliant experts on infectious disease in the world. It's one of the reasons why we produce the 15 days to slow the spread. This is what literally every American can do right now, whether you're in an area of the country that's deeply impacted by the coronavirus or has very few infections. This is what every American can do to slow the spread and lessen the impact of the coronavirus. And I recommend that people go to coronavirus.gov to get information about best practices. But to your point, it's also very important that people listen to their state and local authorities. We forged a seamless partnership with governors around the country. I spoke to the governor of Washington State earlier today. The president spoke to the governor of New York State as well. We're working with those areas, New York, California, Washington State, soon New Jersey, Illinois, and elsewhere, where we've seen significant outbreak. And in those states where there are much stronger measures, to your point, shelter-in-place measures, the governor of Washington State urging people to stay home, stay healthy, and we fully support those decisions. But the president expressed a desire to see America get back to work just as soon as possible. And we're going to be bringing him all the best information about how soon we would be able to put portions of the country back to work or certain Americans back to work. But make no mistake about it, the best thing every American can do right now is put into practice the 15 days to slow the spread. That'll hasten the day that we can get America working again.
And I know, Mr. Vice President, you're very aware of what happened in Arizona. A husband and a wife was watching one of the president's news conferences, and the president stood at the podium and he said that a drug, it's called chloroquine, it's an anti-malaria drug, had shown the potential here to combat COVID-19. The substance is also known as chloroquine phosphate. It has not, Mr. Vice President, gone through rigorous testing as a coronavirus treatment. The wife said that both she and her husband believed the president, and they decided to make their own home remedy using chloroquine. The husband is now dead. The wife is in critical condition. Question is it responsible for the president to suggest that Americans take a drug that hasn't yet been tested for this virus?
Well, first, our hearts go out, not just to that family, but to every American family that's lost a loved one to the coronavirus, and to all of those that are struggling with serious consequences of this disease. And the most important word that we can give to Americans is to talk to your doctor. We do remain, and the president's expressed his optimism about a long-standing malaria drug known as chloroquine, that's been perfectly legal in this country for decades, being used to provide relief to people that have contracted the coronavirus. The FDA has approved off-label use, but it still requires a doctor's prescription to use that. And so, any of your viewers who think that they may have contracted the disease, we say to them, very, very sincerely to reach out, talk to your doctor, listen to your physician. And all the while, I promise you that this president and the White House Coronavirus Task Force is going to continue to work with our pharmaceutical companies as they are developing a vaccine for probably deployment early next year, but also working on therapeutics that'll bring people real relief that could be available as early as this spring. But we're looking for every opportunity where we might be able to bring hope and bring comfort and render medical assistance to Americans. But it's so important, to your point, that people talk to your doctor first.
Mr. Vice President, thank you for your time today, and please do stay healthy.
Thank you very much. I want to thank all of your viewers for the way tens of millions of Americans have gone to coronavirus.gov and are putting into practice 15 days to slow the spread. All our experts say if every American will, at the very minimum, do what the president's guidelines suggest, we'll get through this sooner, and we'll come out stronger than ever before.
Appreciate your time today. We hope to have you back.
Thank you.